by the beginning of next week, we should be comfortable enough to suggest to the government to release the obligation of wearing the mask in public. This should be for the middle of May.
For now, Quebec Public Health recommends these masks no longer be required for public spaces as of May 14th. But Dr. Luc Boileau saying they will reevaluate the situation next week. Although masks would still be required in hospitals and CHSLDs, on public transit, and for those who test positive for COVID.
We're observing that there are less cases of new cases of coronavirus infections. Should it be for elderly people, for youth at school, for health workers? So the signals are numerous, and we consider that we're moving on the right side of it. And with that, we think that the top of the wave, the peak, is behind us. The activity of the virus is still strong in the community. We observe that there are thousands and thousands of people that are infected on a daily basis, so we have to be still careful.
Public health saying vaccines have a lot to do with the decision to soon remove masks.
And this is where vaccination actually comes into the thought process. Vaccination itself, even though we can have reinfection after 2 months, these reinfection rarely bring us to the hospital. Vaccination is very good to protect against severe disease. So we are at this crossroad where we have to choose between going back and living with the virus.
I think people can now make a more conscious choice about whether they want to wear it inside or not. But of course, like for me, myself, like I think I will still wear one for until a certain period of time indoors, especially if it's crowded.
I feel amazing. Like it's been 2 years that I got the privilege to have no mask, so it's feel amazing.
People deserve like having their own choices, and then if they don't want to wear them, that's all right. As long as it's not something like where you're, actively hindering other people, like in hospital.
It's a good thing because we need to go back to normal life as soon as possible.
Ultimately, public health's goal, they say, is to minimize severe infections, and those with health conditions are urged to continue to take additional measures. Asked about Quebec's high death count, nearing the pandemic milestone of 15,000 soon, Dr. Boileau explained the province's tally only appears higher because of the way they count deaths compared to other places, which is something the government has been saying for quite some time.
And we revisited the way the deaths were counted, and at least 30% of them were after 2 weeks of observation were signifying that they were not caused by COVID. COVID was there, but it was not the main cause of death.
In Montreal, Pamela Pagano, City News.